I know. There's no results. Over it later. But now I'm concerned about my friends.
But thank you.
Okay, thanks, Rennie. Good morning, welcome back. So, like I always do in pharmacology, I do anatomy and physiology first. Of course, we need to understand the different organs. Organs comprise the system before we talk about the diseases or the disorders, and then the drugs that are used to treat this disease. Okay, we kind of started with some terminologies, but there's one more terminology I haven't covered. That's why I'm going back to this slide, which is nervous system slide. Oh, because it's a PDF. Don't like PDFs. No friends with me. Anyway, I'm just do this. So remember, we have okay. We have the nervous system. Under the nervous system, we have the CNS, the central nervous system, and the peripheral nervous system. Under the central nervous system are I talked about this, brain and the spinal cord. And then under the peripheral nervous system, we have the nerves and sensory receptors. We talked about afferent and efferent. Okay, what's afferent? Away from the body going to the brain. Okay. What's afferent? Or the brain. The reverse toward the body, which means coming from the brain. It happens so fast, just like when you touch a hot stove. Okay, that's afferent and efferent real fast. Okay, but there's one terminology I'd like to talk about, which is the neurons, before I start with the diseases of the nervous system. Okay, the neurons are responsible for carrying information all throughout the body. It's like your messenger. Okay, it carries the information, just like in my example of hot stove, right? It tells your brain, hey, danger. Okay, so what do? Our brain is programmed to move away from danger. And this is why we don't want to do a lot of things. This is why we don't want to do a lot of things. I want to do that. I can't do that. I don't want to do that. I can't do that. Okay. So let me share with you one book that I read by Mel Robbins, and it's called The 5-Second Rule. In summary, the 5-second rule goes like this. Okay. Because our brain will lead us towards safety all the time. Okay. There are a lot of things that we don't want to do. So say in the morning, I don't reset my alarm to extra 5 more minutes, extra 10 more minutes. Okay. Why? Well, if you do that, you're going to be groggy the whole day. There's a reason why it's called 40 winks. Because a power nap has to be 40 minutes. Okay. And so one of the things I learned in there is do not reset your alarm to extra more minutes, right? Okay, so what do you do? The 5-second rule. What you do when you wake up or when you're doing other things, you count. 5, 4, 3, 2. And one of my students, after I shared this, I said, you want to get up, right? Your alarm came on, you do 5, 4, 3, 2, 1. Blast off. You know, that was the reason too, how when we launch rockets, we don't do 1, 2, 3, 4, 5. we have to do it in reverse. Why? If it's 1, 2, 3, 4, 5, you're gonna follow 6, 7, 8, 9, 10, right? So that's one of the reasons why when we launch rocket ships, we count 5, 4, 3, 2, 1. Blast off. Okay, why? It only takes 5 seconds for your brain to talk you out of something. So you're not giving your brain a chance to do that. Okay, you're in front of, say for example, the convenience store. Choice between a salad and chicken wings. I don't know how they can be next to each other, but follow me here, right? 5, 4, 3, 2, 1, make the right decision. Okay. I had a student who said, Ms. El, most of the time I'm so lazy to go to the gym. But after you shared with me the 5-second rule, at 2, I'm tying my shoes already. I'm almost on tying my shoes when I'm out the door. 5, 4, 3, 2. You want to talk to somebody, you want to ask somebody out. Let your brain talk you out of it. 5, 4, 3, 2, 1. 5, 4, 3, 2. Basically, that's the gist of the whole book. And it's very effective. Okay. So I always share it with my students. Anyway, that's how powerful your brain is. We are programmed to go to safety. Avoid danger. So everything is dangerous and scary for our brain. And that's why don't let your brain allow you, okay, talk you out of doing something. Okay? So a lot of people had failure to launch. So 5 second, 5 second, 5 second. Do it. Okay, did it in 5 seconds. Has something to do with your, okay, how our brain is programmed. Okay, going back to neurons. Neurons are your messengers. They're the ones who talk to your brain, who tell your brain danger, who tell your brain it's okay. Okay, or away from it, away from it. Okay. Connected, they're connected by synapses. Okay, so this is like acetylcholine, ACH, norepinephrine, capital N, capital E, dopamine, epinephrine, norepinephrine, okay, serotonin, and glutamate. These are the messages sent to your brain through the neurotransmitters. Right? What did you notice? Dopamine, happy messenger. Serotonin, happy messenger. Those are your happy messengers. So lack of dopamine, we're going to discuss that. Parkinson's disease, lack of production of dopamine. But you've heard people say, somebody teases me all the time when I'm shopping. Did you get your dopamine fix? Did you get your dopamine fix? Because you stimulate the dopamine or your serotonin, which are your happy messengers. Okay. They said chocolates, right? Stimulate the production of serotonin, which is a happy messenger. Okay. So what is your dopamine fix, Yami? What can you consider your dopamine fix?
My best friend.
Your best friend is your dopamine fix. It gives you a high, makes you happy when that person is around. Kathy, what's your dopamine fix?
Food.
Me too! Shopping. Okay. Rennie, what's your dopamine fix?
Food and coffee.
Food and coffee, but take note, coffee causes anxiety.
Oh yeah, it does. It does. I get bad anxiety.
Okay, because it's sympathetic responses. Okay, but it's weird, right? It's weird because coffee is an antidepressant.
Like you sip it, like make noise, you know?
Like that. Okay, Josh, that's funny. Josh, and some people dip their bread in coffee too, right? Okay. Josh, what's your dopamine fix? A nice cup of tea. Playing the viola. That's it. Sam, what's your dopamine fix? Oh, yeah, because you're depressant. And people around me who causes my stress too. You're not alone. Okay. What's your dopamine fix? Did you say Kathy? Oh, Kathy's laugh. I didn't hear the last part. Sorry. I thought like not Kathy.
Oh, you know, I'm sorry.
I thought she said not Kathy, like teasing you, not you. Kathy's laugh. True. She's got a contagious laugh. Okay. Ashley, what's your dopamine fix? Food and your boyfriend. Yeah, it could be a person. Okay, it could be a person. Okay. I hope that dopamine doesn't go away. Stay slow. That sounds jaded. Ashley. Cooking. That's a dopamine fix. We did some of them. Like in the hobby, one day, 1 hour creative work. What about you, Justin? The gym. That's a dopamine fix. Okay. That's a dopamine fix. Okay. But it also stimulates production of stress hormones, which we're going to talk about later. Okay. What about you, Ty? What's your dopamine fix? Food. Jessica. Not sleeping. True. True. Crave more sleep now than ever before. Maybe from the lack of sleep I've had for 47 years. Right? Calvin. Energy drink. That's a fake dopamine. It's a fake dopamine. That's the sugar. That's like the bad sugar. Dopamine. Okay. Steve. Gaming, I'll guess. Okay. That's good. Okay. Manny.
Getting paid in the next rate.
Okay, so I don't know if there's truth to this, but I'm going to share with you what I've learned back in the day. Okay, clasp your hands together, normal, comfortable way, normal, comfortable way, comfortable, no cheating, no cheating. I don't know if there's truth to this, but just for fun, let's do it. Okay. They said if your thumb is over, right thumb is over your left thumb, your brain over heart, your mind over heart. But if your left thumb is over your right thumb, I see you switch. I said comfortable. Your heart over mind.
So left heart over right brain.
Mind over heart. Okay. Now, let's ask each one. I don't know if there's truth to that anatomically, but I'd like to share that with you. Okay. Is it correct?
Maybe. Yes.
No, you can tell. Like right now, it may change. Who knows, right? Left over it is heart over mind. Right over it is mind over heart. Correct? At this point in life? Yes, for you? No, not correct for her. As I said, I don't know if there's truth to this. Kathy.
I think it's true for me.
It's true for you. Rennie, true for you. Josh, true for you. At this point in your life, people change, you know? Not true. What about you? True for you. True for you. True for you. No cheating. You just have to accept what it is. It's just for fun, like I said, Ty. True for you, the hand clasp. Okay. What about Justin? True for you. So it's about 90% right now, huh? Jessica, what about you? True for you. True. True for you. True for you.
Left over right or right?
I don't know. I'm not even asking.
Is it true? Is it true?
Is it true? Because he said this is kind of true. Like, if your left thumb comfortable clasp, heart over mind.
That's not true.
Like you put both your hands together. What does it mean in the pyramid?
Is that
You clasp them.
no. Okay. Complicated. Okay. Steve, is it true for you?
My brain is over my left.
Is it true?
My brain is over my left.
Just say
Is there my? Is it true at this point? At this point in your life? Okay. So that's what I always say. Okay. I've seen this and I like you to listen to this. Okay. Lead with your heart, but make sure you carry your brain with you. Okay. I've always been my entire. But when I had a child, it changed. Okay. And then there's another thing. All of the impulses, not all, 90% of impulses, okay, that is transmitted to the brain comes from the heart. And this is why we thought when we fall in love, I love you with all my heart. What you should say is, I love you with all my brain.
I like that.
Yeah. I love you with all my brain because this is where everything is coming. But what's interesting is 90% of the messages, 90% comes from.
My heart's so big.
Okay, let's continue. So know that the neurons carry the information. They're messengers. They're called neurotransmitters. And we have happy messengers. We have stress hormones. We have all of this stuff together. But we want to stimulate the production of those happy hormones. Okay. And sometimes when there's underproduction or no production at all, that's when disorders happen. And that's what leads me to our next topics, which are the diseases of the nervous system. Okay. Let's start. But before we start that, let's do a knowledge check. The two divisions of the nervous system are CNS and PNS, central nervous system and peripheral. What consists of the central nervous system? The brain and the spinal cord. I think you will not forget this with my story of the mouse, right? Short answer. What are neurotransmitters? Messenger. Okay. Messages that are sent. Okay. Now I'll start with seizures. That's the next PowerPoint.
Miss I told my family the story you told me. They were all dying of like
Oh my
laughter horror.
god, right?
There's like the horror.
I know. I cannot forget that story too. It's very sad. Okay, let me get my other PowerPoint. Pathology. So what does pathology mean? Study of diseases, correct. And we're going to start off with seizures. Seizures. I want you to watch a short video on seizures. It's easier.
Seizure.
No. So this is by the Children's Healthcare of Atlanta. I like it because it's short, straightforward, 30 seconds. That's a rapid fire. That's a rapid fire. Supposedly it's like, that's it. That's why we say the screws got loose, something fired up. Okay. because it gave you an explanation of how it looks like. Now we're going to talk about, where's my other? Seizures, different types of seizures in detail. Oops. Where did it go? Downloads. We'll start off with seizures. There you go. Like that, it's a PDF. Okay. Seizures. A change in behavior or function caused by abnormal electrical discharges in the main part of the brain. All right. Who has witnessed somebody have seizures? You have personally witnessed? Okay. Manny, can you describe what you've witnessed?
I thought it was weird because like the two, like I was working at the rent-a-car center. That was like two passengers
You were working where?
at the rent-a-car center. And like two dudes were like talking to each other and one of the dudes just like just fell on the ground and started twitching. So
Started twitching. The word twitching. Started twitching. Who else? Let me see hands. Okay, Rennie.
I was at my work in the casino. Lady was like rushing towards me. I don't know if you know what she was doing, but I tried to catch her, and then she felt heavy, so I just dropped her. She just was on the ground and it's awful.
Okay. So he said she seems like she knows what she was doing, or she knew what she was doing. Many of our patients, especially if they've experienced seizure, if they experience seizure regularly, know what to do. Okay. They lay down on their own voluntarily when they start to feel it coming. They lay down, you just have to give them space. Okay. Some of them bite on a towel, some don't. Okay. Back in the day, people would put spoon in their mouth, which we don't do anymore. We should not do that because there should be airways that the airway should be clear. Okay. So they know because they've had this since they were young. I had two students, twins. Okay. And they told me that they experienced seizures. So I asked, when was the last time you had seizures? You have to tell me this thing. So I turn the lights on and off, especially when I'm lecturing. Notice that? Okay. So during that time that I had them, I said, you have to tell me this things. I had other people who had seizures, but this two particularly, their trigger was a light. So they never got to watch any concerts or whatnot. Apparently both of them just had an attack a couple of months ago. So here's what I do when I know that there's somebody who experiences seizures in the classroom. Okay, I'd count. So there's a warning. 3, 2, 1. Then I turn the lights on. 3, 2, 1. I turn the lights off. So what I did during the time they were with me, one of the twins will be the light keeper. Okay, light switch, light on. So it's cute, like they'd close their eyes and then they'd warn the whole class, lights coming on and lights coming. Because a simple thing like that would trigger it. Okay, Miss McGinnis, that's why I'm warning you. When you go to Miss McGinnis, please do not carry a click pen with you. It's the click pen that triggers for her. Okay, and it's really bad. We go together most of the time because I don't like driving around town, so she drives. And I've witnessed it happen in one of our pharmacy visits. There's this lead tech who kept clicking. And she asked me, why do pharmacists like clicking their pens? I said, just sorry. It's usually what the pharmaceutical reps give us, their click pens. Okay. Another thing, she's allergic to certain scents too. So it's rose specifically. And you know, when we go to pharmacies that are in retail stores, the first one that sometimes says hello to you are roses or their floral area. So I already know. I said, oops. And then she won't breathe, or I'll take her in a different route. Rose and lavender for her. So since we started working together, I stopped wearing perfume at all. Except for, because I like what do you call this? Tea tree and eucalyptus combination, and she loves that. Okay, because it's common for me. So anyway, there are different triggers for each person. And sometimes it's just sound, sometimes it's noise, sometimes it's the lights, strobes, blinking. And that's why you will notice some games or some videos or some movies will have a warning. Okay, like in theaters, sometimes they have a warning, especially if some parts of the movie will have those effects, lighting effects. Okay, it's very important that we warn those people. Okay, autism. Okay, people with autism, they have to be warned too, because sometimes it triggers them. Okay, it triggers them too. Remember the rapid firing? It's not just for seizures or epilepsy. Okay, so what else did you notice? Ty, you said you because you work in a hospital. Okay, what did you notice? Hmm. Put them on the side. Like I said, back in the day, don't put anything in their mouth. Because back in the day, we put like a wooden spoon for them not to bite their tongue. No. Okay. There should be airway in there. Like I said, many people, many patients who experience seizures since they were young, they already know what to do. You just have to give them space. And then picture this. These are electrical impulses. Think about you getting electrocuted for about a minute. How would you feel after?
Tired.
Very tired, drained. And that's why they look very tired and drained. And sometimes it takes them days to recover or even weeks to recover from that. Okay, even if it's just a minute or 30 seconds. And we're going to talk about the different types of seizure. Okay. Convulsions. Convulsions are also electrical firings involving contractions, loss of control of movements, distortion of senses. That's why sometimes when they wake up, they didn't know what happened. And we're going to talk about the different types of seizure. Okay. They didn't know what happened. Some pass out, some don't. Some are conscious, some are not conscious. That's why there's different types of seizures. Okay. Epilepsy, on the other hand, is a neurologic disorder of sudden and recurring seizures. So this one is recurring. A convulsion is just like that particular moment, that particular attack. That's a firing, electrical firing. But when it's recurrent, now you're considered to have epilepsy. Okay, I've had a good number of students who had epilepsy growing up. And so I appreciate these things. Why? It's better that I know, so I know how to handle the class. I give you warnings about the lights or what we're gonna do, if we're gonna do something physical or something that I was thinking may trigger you. Yes, Steve, you raised your hand.
I've seen some videos of where people trying to bring awareness to some seizures. And I don't know the names of it, but they are awake and aware, but they become totally paralyzed. They can't talk, they can't move their fingers, some can only do
After the seizure
during it as well.
and during it, okay.
Some can only move their fingers or they can't talk,
That's my next
they're
topic.
just total paralyzed.
Yes.
What kind of seizure is
Okay, that's my next topic. And if you read my lecture packet, I differentiated them in the lecture packet. Okay, it says exactly how many seconds, how long. It is differentiated by how long it happens, whether there's an absence of consciousness or not. Okay, but going back, epilepsy, neurotransmitter levels are unbalanced. It's imbalanced, okay? You know that there's something abnormal happening, right? I don't know why it's not normal. But okay. Causes of seizures. What are the causes of seizures? Illegal or recreational drug use may lead to seizure. One of the side effects. Okay? One of the side effects. Alcohol withdrawal may lead to seizures. Extreme intoxication. What does that mean? You're so wasted. Rennie said you're so hammered, like hurting yourself or cutting yourself because you're so intoxicated and coming to class with a band-aid on your face. You're still not getting anything he says. He doesn't remember it. He's too intoxicated. Remember when he came here? I said, what happened to your face? Oh, now he gets it. Okay. Extreme intoxication may lead to seizures. Okay. High fever. Very, very high. That's why it starts off as convulsion. See, that's why we manage high fever. Okay. Give them Tylenol right away, acetaminophen. Okay. Because when it's too high, they may, what? It may lead to convulsion. Okay. Hypoglycemia. What's hypo? What's gly? Sugar. What's emia? In the blood. When your blood sugar level goes very low or goes very high, either one. It's crazy how low blood sugar levels and high blood sugar levels have very similar signs and symptoms, same as high blood pressure and low blood pressure. Okay, that's why we monitor. That's the trick. We monitor meningitis, usually with kids. Right, so we watch them, the newborns. Okay, when they have high fever, we want to make sure that we control that elevated body temperature. Okay. Tumor in the brain may lead to seizures depending on the location of the tumor. Okay. Head trauma may lead to seizure. Okay. Concussion may lead to seizure. Okay. Here's the first type. Major types of seizure. We have what we call a focal. What do you think that is? Center. One portion. One part. Directed. A focal. A focus, right? Focal is localized seizure in one specific area or hemisphere of the brain. In this picture, in this example, it's just this part. Okay? This is a direct result of injury. That's why I said concussion. Okay? Head trauma. Okay? To the cerebral cortex. Simple focal seizure, no loss of consciousness. Twitching. Still twitching, but no loss of consciousness, meaning they're conscious. Okay, they're still present, but they're hazy. All right, they're hazy, so they don't remember a lot of things. Hazy and foggy. Okay. Complex focal seizure, okay, is impaired consciousness, meaning unconscious. Okay. There's like spacing out, like staring spells. Okay. And then there's what we call a post-seizure amnesia. What's amnesia? They forget things, right? After the seizure, you don't remember anything. They'll ask you like, why? What happened? Right? Okay. Now let's talk about this. Generalized seizure. One of the most common one is called the tonic-clonic seizure. Okay, tonic-clonic has two phases. Tonic is the stiffening. Okay, you stiffen first. Clonic is the shaking part. You see them like stiffen, shake, stiffen, shake. You see them. That's why you said they're twitching. Okay, in a tonic-clonic seizure, which is the most common, the tonic part is the stiffening. Okay, so they're gonna do like that, their toes like pointed outwards. Okay, and then clonic is the shaking part. Okay, muscle jerks, shallow breathing, loss of bladder control. So they may pee themselves or urinate unconsciously, of course. We have the next one, what we call a status epilepticus. Yes.
We can give it to you, but we already plug it in.
No. What do you mean? You want an alcohol prep pad box or just a box?
A box.
A box of alcohol prep
Yes.
pads. Okay. Can somebody get a box of alcohol prep pads at the back? You, Jessica, know where it is. She always gets it. And we have 2 boxes that's still out. Okay. Status epilepticus. Thanks, Jessica. Status epilepticus. Continuous tonic-clonic. Continuous. So continuous stiffening and continuous shaking, then back to stiffening, then back to shaking. It's a cycle. Stiffen, shake, stiffen, shake, stiffen, jerk, stiffen, jerk. I'm not calling Steve. Right? Okay, so the stiffening and then shaking, stiffening. So when you say status epilepticus now, it's a back and forth tonic clonic lasts 30 freaking minutes. I couldn't picture being electrocuted for 1 minute, and this is 30 minutes. Okay? Characterized usually by high fever, lack of oxygen in the brain, which Steve was talking about. When we start losing oxygen in the brain, this may lead to a stroke. Okay? Then here comes your, because these are all under generalized seizures. Those are all in my lecture packet too. Okay? Absence seizure. What do you think absence is? With consciousness, without consciousness? Unconscious. Absent. The person is already absent. Left the body. Right? Like a ghost. Last, thank God it only lasts 10 seconds to 2 minutes. Absence seizure include blank stares, rotating eyes, rapid eye blinking, twitching, uncontrollable facial movements, often resulting from an aura. Sometimes the absence seizure is not fully unconscious, like awake, but not there. You following? What was that?
Lights are on, but no.
I didn't hear lights are on, but no one's home, right? They don't know what's going on, but technically they're already absent there, right? Others are really unconscious. Myoclonic seizure. What do you think this is? Let's break it down. Terminology. Myo means muscles. And then clonic, what did I say about clonic? Jerking, twitching, okay? Seizure. This one has no loss of consciousness. Sudden quick jerks of extremities, your hands and your legs, can occur during deep sleep. So it is scary too, okay? Because it happens while sleeping. Atonic seizure. What's tonic again? Stiffening, right? Lasts seconds to minutes long. Sudden loss of muscle tone and consciousness. They collapse, and when they're done, they limp. Okay, atonic seizure. Now let's talk about treatments for seizures and convulsions. First one, sodium channel blockers. Block sodium channels, making neurons less likely to fire. Okay. Say Tegretol. Say carbamazepine. Okay. This is for tonic-clonic, focal, and mixed seizures. Side effects include rash, dizziness, and drowsiness. Okay. Tegretol, carbamazepine. Next one, Vimpat. Say Vimpat. Say lacosamide. It's a C5. Take note, not all anti-seizures or anticonvulsants are controlled. Not all. Okay, this one is, it's a C5. This is used for focal seizures. Same dizziness, fatigue, and tremors are the side effects. But the most popular one will show up on sodium channel blocker will be your Dilantin, because it's the oldest one. Say Dilantin. Say phenytoin. Very good. Say again, Dilantin. Say phenytoin. Vimpat is new, fairly new. It may show up, but this one, if you're asked which amongst this drug is used for seizure, usually this is in the options in the PTCE. Okay? Tonic-clonic, absent seizure, and preventive seizures. And that's why it always shows up. It's got a wide use. Okay? Side effect, decreased coordination and movement, mental confusion, slurred speech. A lot of our patients with seizures or after seizures got slurred speech. Okay. Next one, after the sodium channel blockers, we have calcium channel blockers. Same principle, except it blocks the calcium channels or less likely firing, electrical firing in the brain. Okay, say Depakote. Again, say Depakote. Say divalproex sodium. Very good. Okay, common because it's an old drug. Common to show up in the calcium channel blocker. Okay. Side effects: headache, drowsiness, nausea, vomiting. But it's used. Why is it common to appear as well? Wide use. See that? Absence, mixed tonic-clonic. Okay. Consideration, important. Should not be taken with aspirin and other carbonated beverages. Why? This will combine with the drug. Okay? So no sodas when taking Depakote. Is that clear? Okay. The carbonation. Carbon mixes with the drug, as well as aspirin. Next one. Another group of drugs which is popular for seizure, we call it GABA. Say GABA. These are your GABA enhancers. It means gamma aminobutyric acid. Gamma aminobutyric acid. It also inhibits firing of the neurons. Okay. This will show up. Neurontin. Say neurontin. Say gabapentin. Okay. This is specialized for focal seizures. Side effects, a lot of them. Side effects are very common. Overlap, dizziness, fatigue, nausea, and vomiting. Right? Lyrica will show. Say Lyrica. Say pregabalin. Look at this. GABA, GABA. You see that? Okay. Lyrica though is a C5. Okay, so we have two controlled now. What's the other one on the previous slide? Vimpat is also C5. Okay, they have drowsiness effect. That's why some use it to help sleep. Okay, next one. This will show up because this is old. Luminol. Say luminol. Say phenobarbital. Here's one. Barb. Barb. Those with barb are called barbiturates as class. Pharmacological class. They have a core, okay, or a root that's barb. Phenobarbital, secobarbital. Heard that? Okay. They're barbiturates. Now you know that barbiturates are for okay. And barbiturates are all C4s. You follow? Just memorized how many drugs? Not even done yet. Okay. Phenobarbital, secobarbital, or barbiturates, anti-seizures, anticonvulsants. Okay, barbiturates are C4. Okay, next one. We got glutamate inhibitors. Okay, say lamictal. Say lamotrigine. Focal seizures as well, okay? Side effect insomnia, rash, increased coordination. This one, Topamax, say Topamax. Say topiramate. Okay. Uses tonic-clonic and partial seizure. Side effect, again, insomnia, loss of appetite, weight loss, nausea, and vomiting. Okay. Structurally, synaptic vesicle, protein binder, structurally related to other anticonvulsants. However, mechanism of action is unknown. These are newer drugs, okay? But their use is an anticonvulsant, but they don't know the MOA, okay? But it's been proven by patient that it works as an anticonvulsant, okay? So here comes your TAMS. Okay, say brivaracetam. Your cetam or your TAM. This is different from your PAMS and LAMS. Are you following? PAMS and LAMS are benzodiazepine. And what are they? Therefore, anxiety. Are you following? And benzos are C4, just like your barbiturates are C4. Are you following? Got a lot of drugs now, okay? Levetiracetam. You just cover it. In other words, Keppra. Keppra is popular, so you want to remember Keppra. Say Keppra. Focal seizure as well, side effect. If you see it, all of them have almost the same side effect. Drowsiness and vomiting. Lack of energy. Fill in the blanks. We jump to the book. Blank is a neurological disorder characterized by recurring seizures. Epilepsy. How when it's recurring, it's epilepsy. Which of the following is a type of focal seizure? Focal. True or false? Lyrica is a C3 drug. What is Lyrica? C5. You got to remember, Lyrica is 5. Vimpat is 5. Your barbiturates are 4. Your benzos are 4. Okay? Now let's pull up your books.
Ativan is a standing order in a hospital.
Book. Sound like a chicken. Pull up your books. I'll help you study this ones. Barbiturates are 4. As well, so your phenobarb, your secobarb, phenobarbital, secobarb. Okay, remember I told you one of my students pictured it as a Barbie doll that's having a seizure. Barbital. Okay, let's look for the drugs. Find your nervous system in the book.
It's the 200 words.
Top 200 drugs.
It's on 200 words. 200 drugs.
What page? Physical book, and I can see there's nervous system drugs. The first one, 10, page 10. Page 10 on the physical book for me. Okay. So let's find our drugs this time. It's not for migraine. I have a lot of migraine drugs here. Okay, I found phenytoin. Find it? Dilantin, brand, generic, phenytoin. Classification, this is your therapeutic class. What is it for? Anticonvulsant. Did you find that? Prescription only. Depacon is next. Depakote. Didn't we cover this? Valproate sodium. Okay. Anticonvulsant as well. Did you find that? See how I grouped it? You're welcome. And the next one is Keppra. It's still in there too. Keppra. Levetiracetam. Again? I'm on page 11 now of the physical book. What about your ebooks? What page? 18? 18 on iPads and laptops. I don't know. Phone might be because phones are smaller. Might be farther down. Okay. Keppra is there. Highlight them. Okay. Neurontin is here. Gabapentin. Anticonvulsant. Lyrica is here, and it says here it says C5. Another one. Anticonvulsant. It's also used to treat pain caused by fibromyalgia. Okay. On the other side are your antidepressants. We skip. Antiemetic, and I think that's most of it for this particular topic. We're still going to go back to this for the Parkinson's, antidepressant, anxiolytic, and antipsychotics. Okay. So, seizures. Any question on seizures? No questions?
Those are the drugs that prevent seizures.
Yeah. Okay. And convulsions. That's why they fall under anticonvulsants. Okay. Barbiturates. What class? Or do not confuse them with benzodiazepines. They're also but they're for anxiety. Benzos are for anxiety. Barbiturates is for convulsion and seizures. Okay. What else? Vimpat. What class? C5. Okay. Gabapentin. Controlled, non-controlled. If I didn't mention it, non-controlled. Okay. So not all anticonvulsants or anti-seizures are controlled. You have to remember the ones that are controlled though. Okay. Lyrica. Class. BA class. C5. Okay. Any questions before I jump to the next topic? 2-minute break. I'll start at 11:25. 2-minute restroom break and start again. So I'm on nervous system part 1. I'll move to. They're like wrestling in there.
I'm about to go in there and yell.
That's a cool first one.
Stop being a grumpy old man, Steve.
I'm trying to concentrate.
Pathology. I'm on pathology of the nervous system part 2. Okay. My next disease is Parkinson's disease, which is very interesting too. You watched the video with me. The stats, remember? Stats have Parkinson's, and we'll talk about that. Let me download my PowerPoint. Let's talk. Just 2 minutes to breathe. See. Next, pathology. Okay. Parkinson's disease and the drugs that are used for Parkinson's disease. But let me tell you about this first. Remember how we were talking about earlier neurotransmitters? And one of the messages that we send, or neurotransmitter, is dopamine. Remember that? What did I say about dopamine? We talked about dopamine fix. It is one of your happy messengers. Okay? In Parkinson's disease, the problem is either lack of production of dopamine or no production of dopamine at all. Okay? What you notice when we watch the documentary Stunts? What's evident as a sign of Parkinson's with a psychiatrist? The shaking, the tremors, right? Okay, the shaking and the tremors. You remember that part when he said, "Can I take you home? Because look, it's not going away. It's going away. Like the tremors and the shaking is gone." Let me explain to you what happens in the brain and what happens why the shaking goes away. Okay. Who knows Muhammad Ali? Okay. There was a documentary on Muhammad Ali. You know how he has Parkinson's disease, right? A lot of boxers have Parkinson's disease. They said it's from getting beat up in the head back in the day, but there's no proof to that, okay? Because it is lack to no production of dopamine, okay? Lack to no production of dopamine. So they did a study on Parkinson's disease documentary with Muhammad Ali. So Muhammad Ali has Parkinson's disease and he's shaking. Okay. If you know Manny Pacquiao, who knows Manny Pacquiao? His coach, Freddie Roach, has Parkinson's disease too. Okay. So they took Muhammad Ali in this documentary to a boxing gym. And he was sitting on the side watching the boxers fight. And then one of the crew asked him, would you like to be on the ring to spar? And he said, yes. They put him in his boxing shorts and boxing gloves. And the moment he stepped on the ring, the shaking went away. It happened at that moment. Even the dopamine fix was there was production of dopamine at that instance getting on the ring because it's something that he loves to do. So there was stimulation of dopamine production. Same is true with Stutz. So look, it was calming him down. Okay, so know that Parkinson's disease is a lack of dopamine production. Okay? You already know the signs. Looks like seizures, right? But it's not a seizure. Tremors while resting, rigidity, absent movement. Dopamine is an essential neurotransmitter for voluntary muscle movement. So without it, or with very little of it, there's going to be shaking. Okay? Parkinson's is decreased dopamine production, part of age, and it's part of the aging process. As you get older, less dopamine gets released by the body. So you got to find things that make you happy. And as you get older, sometimes you'll be surprised, like, why did they divorce? They've been together too long. They just realize it can't be with a person that doesn't make me happy anymore. One, anatomically and physiologically, I don't produce enough dopamine anymore. This freaking guy or this freaking chick gives me problems. Like, Mom, Dad, you're like 80, you're divorced? It's shocking. Like, it's funny, but it's true. There's no cure to Parkinson's disease. Okay. So the goal of treatment is to relieve patients of symptoms. And this is my tip to you. On the PTCE, when you're asked and you know that the disease doesn't have a cure, the answer all the time is management of symptoms or disease-related symptoms. Is that clear?
Clear.
Another tip today. Okay. And here's how interesting this is on the treatment. Popular drugs for Parkinson's is called levodopa or L-dopa. Levo stands for the left side. Okay, levo. Let's say levo. Levo stands for the left side. Okay. Dopamine. Here's my butterfly. When I draw this, what do you think? It's the brain. And this is what you call the blood-brain barrier. Okay. Dopamine cannot cross the blood-brain barrier, which means it cannot get through the brain to have an effect on it. Dopamine, the natural dopamine. Okay. So these pharmaceutical companies are so great, they got so much money, and they tested that if they just tweak the chemical configuration of dopamine to the left, that's why they called it levo, to the left, it will pass through the blood-brain barrier. So this is synthetic dopamine tweaked to the left side. Following, we have a lot of drugs that are synthetic, which are copies of the naturally occurring chemicals in our body. And this is one of them. And this is why for the longest time, L-DOPA or levodopa is the #1, not cure, treatment for Parkinson's disease. Dopa came from dopamine. And then they tweaked it to the left side, levo. Okay, interesting. Cinnamon, brand name. Okay, levodopa, it may come as L-DOPA, carbidopa. You see? Giveaway, dopa, because it's a dopamine agonist. It stimulates the production of dopamine. Okay? Mirapex, say Mirapex. Say pramipexole. Pramipexole, okay? For chronic Parkinson's disease, known for having fewer side effects than most Parkinson's disease treatment. That's how pharmaceutical companies roll. Of course, they're going to try to discover something with less side effects. Okay? Plus, it's part of the business. This one shows up on the PTCE, and I'll tell you why. Not only because it's a Parkinson's disease treatment, Requip, ropinirole, okay, is also used for what? Can somebody tell me?
What?
Yeah.
Restless legs and.
Yes, that's why it shows up on the PTCE. RLS, restless leg syndrome. It's a treatment for restless legs. For those of you who are traveling long flights, international flights, make sure, don't care. Even if you're in economy, walk down. Who's to stop you? Yeah. Request for the aisle seat so you don't bother anybody when you do that. Yeah. What's the aisle seat? Like, excuse me, and they're sleeping. Okay. What's the aisle seat? Okay. Or pay extra for the aisle seat. And then walk back and forth. Compression socks. Okay. Oh, because it's very common for people who especially have been sitting a long time, either in ground transportation or flight, you'll see that your feet are swollen to that long flight. Okay. It's because of lack of circulation. And the way to help you minimize that is by wearing compression socks. Okay. You're flying a solid, but it's quick. Yeah. But long hauls. Okay. Next one, anticholinergic. I want to talk about this. This is when I talk about sympathetic, parasympathetic. Let's go. Rennie, you want to take note of this? That's why I did not discuss the Pharmacology 101. Okay. Sympathetic is also called adrenergic. Adrenaline, think adrenaline. Yeah? This is your fight. You say fight or flight, right? I say this, fight, fright, or flight. So it's easier for you to picture what happens when you're up in the air, what happens when you're scared, and what happens when you're fighting with somebody. This shows up all the time. There is an adrenaline rush. So those are the most common ones that show up. What happens? Hi, Especially graduates today, even if you don't walk, once I sign, once you exit, it's done with the exit, I stamp my name on your diploma. It's gonna be mailed out.
Oh, wow.
It's gonna be mailed out. Let's just walk with you guys. talk about your site real quick. What have you learned? What are the things you've learned here that are useful for your site?
Okay. The last site was Smith's Pharmacy, and what you really have to look at, well, pay attention, like remember from now on is like the drugs and the class. Because they're always gonna ask you, oh, where's my prescription for my high blood pressure? And if you don't know the name, you're gonna get stuck with it. You're gonna be like, oh, you have to keep asking questions like, oh, what? I have to like ask a tech and be like, oh, which is the high blood pressure? And if you get that on your own, that'll be better. Like you'll look better in their eyes. So mainly the classifications, the drugs. That's my main thing. But yeah, I learned a lot of things. Like I learned picking in written prescriptions, getting fax over prescriptions, transferring pharmacies. Yeah, I learned way more in the Smith's pharmacy than I did in the specialty pharmacy.
Very quiet in there.
Yes.
In the specialty.
But I like it.
Yeah, but you'll learn different things on both. Yeah, you learn to compound, and the other one is a closed store pharmacy. That's why it's very quiet. It's a closed store setting. Okay, but you can listen to music, and they're all nice people in there. We have graduates in there.
Yeah.
Did you enjoy both?
Yes, I did.
Okay. Sorry. I know you're gonna walk with her too, even if she's a graduate. Because remember, we only walk twice a year. Summer and a winter one. So the summer usually is July, but since the pandemic, we kind of moved it to August and back to July, so we don't know. And we don't know if there's going to be a December next year or it's going to be a January.
Ours is in March.
Yours is in March, see? Changed. Depends.
We're not gonna.
We never had a March. This is the first time we're going to have.
Yeah.
You finish in March. If you have 1 week till graduation, you might be able to walk with her. Of course. You got questions for Carla?
I'll think. I'll
Was
think
it
so, yeah.
scary?
Okay, she's just gonna stay till the end because she wants to wait for you guys. Okay, let me finish my sentence. What's your question?
No, me asking a
Stop the
question.
drama, okay?
Ask the question.
What's your question?
How did you get it over the initial, like, the going into let's sequence we were talking about the fears, like of asking the text.
Oh, how did you get over fear of asking people?
Yeah, like how
Patients, pharmacists?
No, the text for help.
The test.
I feel like I got over it pretty quickly because I kept asking. My first day, I kept asking the girl next to me, like, "Oh, can you help me?" Because I feel like I was more scared to make a mistake than to ask.
Very good. It is better to ask and be stupid for a while than to keep silent and be stupid forever. And they know you're new.
And
Did you ever feel that they don't like you asking questions?
No,
Oh.
they're all really nice about it. Everyone was. And then when you have your last senior meeting before you ask the site, they give you a notebook and write everything they tell you in there. Like if you ask, "Oh, how do I do this?" Write it down so you ask next time. So that's what I did.
Really good. Okay. Any more questions? She's gonna wait for you.
I'll wait.
Okay, that's so nice of her. Thank you. So sympathetic. Another term for sympathetic is adrenergic. Think adrenaline. Okay. Fight, fright, flight. Those are the ones that show up on the PTCE. What happens to the pupils during sympathetic? Dilate. Okay. What do you think happens to the blood pressure?
Goes up.
It goes up. Okay. What do you think happens to urination, defecation? It stops. Have you ever seen a boxer wet their pants while they're no, not at all. So no urination, no defecation, no ejaculation. Okay. Next one, sympathetic. We have parasympathetic. Okay. Responses or drugs. We call this cholinergic. See how I'm tying it there? Cholinergic. Other term for parasympathetic is cholinergic. This is what I call your rest and digest. Okay. So think what happens after you eat. What happens when you're calm? So what happens to the pupils?
They constrict.
Constrict. Okay. What happens to the blood pressure?
Goes down.
Goes down because you're so relaxed, right? What happens to After you eat, you want to use the restroom, right? So you check urination, check defecation, and when men are bored,
They jack off.
I cannot say that. Okay, sympathetic and parasympathetic. I always say I wish my pharmacology professor had taught this way. We have this thick book called Goodman and Gilman, and of course, it's like all medical terminologies. It's so hard for me to understand, or all of us. So what we did, we found a book. One of my classmates found a book. It's still available on Amazon to this day, called Pharmacology Made Ridiculously Simple. Okay. And it has some cartoons, like picture. For the sympathetic, it was a picture of a boy with spiky hair, okay, like surprised, yeah, with bulging eyes. Okay. So that was what I remember to this day. That's my sympathetic, right? Adrenaline. For the parasympathetic or cholinergic, it was a picture of a pig by the beach lounging. I don't know how to draw, but this is not a cat. This is supposedly a pig. And the pig was holding his belly. Okay? Like
Did
this
you
egg.
say
Yes, that one. So anyway, that's so old, so the drugs are not updated. That's the exact one I have at home. Okay. So anyway, I cannot forget this. Okay, which leads me to treatment for Parkinson's disease. What do you think cholinergics are? They block, yeah, the cholinergic responses, okay, or balance out the cholinergic activity and reduce the tremors. Say cogentin, they benztropine. Not so popular because it's new, but cogentin may show up. Okay, trihexy. Say trihexyphenidil. This is used for, this manages the tremors, used for the tremors. This one is for the early disease symptoms. That's why I said this may show up because this is older, okay? And this is for the early stage, okay? Adjunct therapy, later disease, meaning it can be taken with another drug, adjunct, okay? Concomitant treatment. You saw the pig! There's a
they
pig!
made a newer version, like a faded version?
Did you see the spiky hair boy? Sympathetic. Did you buy it? You found it right away?
No, yeah, I found it right away, but it gives you like a little preview.
A preview? That's a pig. Well, I never learned from that book that was so thick and so expensive. But I learned from that very cheap book, less than $100, because of this. So I make my notes like this. Like this, like this, like this. Right? Okay, next. Say COMT inhibitors. What's wrong with them in there? COMT inhibitors. Say catechol. Methyl transferase. Do not forget the word inhibitors because that makes a whole lot of difference, right? Agonist versus antagonist, right? Agonist stimulates, antagonists are blockers. Same as inhibitors, they block, okay? So, say Tasmar, say Tolcapone. This is used in combination with L-Dopa or levodopa and carbidopa. Okay. Risk of liver damage. Content. Say content. Say entacapone. What's common? Capone. Capone. Right? Deteriorating response to levodopa. We give this if the patient starts not responding to L-Dopa, levodopa, or carbidopa. Okay? This is colors that you read. This one is what we call our MAO inhibitors. Say monoamine oxidase inhibitors. These are also antidepressants. Okay. These are also antidepressants that must not be given with alcohol. Tyramine-rich food, which is beer, cheese, sauerkraut. Yeah? So that's a common question on the board exams. Okay, so monoamine oxidase inhibitor, I call MAO inhibitors, should not be given with tyramine-rich food. An example of this always shows up on the PTCE, are your cheese, sauerkraut, pickles, okay? Beer, anything fermented, okay? Say azilect. Well, this are not used for depression, but the class MAO inhibitors, as your antidepressant. These ones are for your Parkinson's disease, this particular brands. Say Rasagilin. What did you notice? Okay. For Parkinson's disease, but it'll be different when it comes to depression now later. Okay? But for now, we do this. For your homework on Friday, what's the on and off phenomenon in Parkinson's disease? Okay? What's the on and off phenomenon in Parkinson's disease? Okay? What's the on and off phenomenon in Parkinson's disease? What does that mean? Okay? Yes, you want to put that in the basket. It's a prescription, a verbal order. What's the on and off phenomenon in Parkinson's disease? Let's do a knowledge check. Last one, last part. Which of the following is not a characteristic of Parkinson's disease? B. Fill in the blank. Blank is a neurotransmitter responsible for muscle movement. True or false? Parkinson's disease is curable.
Oh.
There's no cure, only management of disease-related symptoms. Always the answer for drugs that has no cure. And take note, just another tip, autoimmune diseases don't have a cure. Any questions? No questions? No. Good job.
Wait, so for Friday, we just turn it in the basket? Or
Turn it in the basket. What's the on and off phenomenon? What's the on and off phenomenon in Parkinson's disease? Just turn it in. What's the on and off phenomenon in Parkinson's disease?